So now that we're moving on to more intraoral interventions, this is where I would be able to see if my patient clenches or not, if they're not aware themselves. So if you look at the edges of the tongue on the side, it's gonna look like some ridges. I don't have any, he doesn't have any, but you would notice it's not a smooth side. It's gonna look like little edges. And then you can also look on the inside of their cheek. If there is any scarring or lines, that is going to be where that cheek is kind of being bitten by the tooth throughout the night. So, different intraoral interventions we can do is a masseter release. This feels really good on patients. And so what I'm doing is I'm coming in on the cheek, and then I have my patient relax, and I'm just gonna be feeling for that masseter muscle. And you can do some massage, you can come up and down along the length of that masseter. If they have any adhesions, you will feel them. Sometimes it's like a banding, sometimes it feels like a bunch of peas. And just hanging out here until you can get some of that to release. Gonna feel really good. This is something your patient can also do at home, and you can prescribe for them to do at home. Now for actual mobilization of the TMJ, the first one we can do is where my thumb would be on the top of the teeth here, and then that is going to be coming into that protrusion motion. So I'm going to do a little bit of distraction where I'm pushing down, and then protrusion where I'm pulling up. So I would find the top of those molars. My thumb is just kind of hooked around the jaw. I'm going to have my patient again relax for me. I should feel their top teeth on the top of my thumb. So I'm going to be feeling their TMJ joint with my other hand, and then I'm going to be blocking out their forehead with my shoulder. That just prevents any extra movements. So I'm going to push down and pull. I can also do just straight distraction where I'm just pushing down. This is a good one for right away, just trying to get that motion, decrease some of the pain. As I'm taking my thumb out, I don't want my patient to help me by opening their jaw, because that just kind of undoes everything that we did in there. And then one more thing that I can do while I'm in there is to get more of that lateral deviation. I can come past those teeth on the inside of the jaw, and I'm gonna kind of hang out back here. Now this can be a pretty tender spot for the patient, so warning them that there's gonna be a little tenderness. They might get a little gaggy, so I'm gonna have my patient tap my arm, make a noise, whatever, if I need to, get out of there. So we're gonna try that. So we're gonna come in on the inside here, and then again hooking around the jaw, and then I'm gonna come kind of more towards the camera, and that's the motion that I'm gonna be doing. Not too bad? Pretty good? So that's gonna again be helping with that lateral protrusion, lateral deviation of the jaw.